Hello, hello. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is September 26th. We are here to do a live IC support group meeting. This is one of my drop-in unscheduled support group meetings. I'm always curious to see who's going to be online and if anybody's struggling. So we're just going to take a moment and talk about IC and take questions on IC and talk about some of the big news on IC. Hello, Nancy. It's very, very, very nice to see you. So guys, we are simulcasting on Facebook and YouTube. So if you see my eyes wandering all over the place, that is why. You're always welcome to ask questions in your comment area. For sure. Let me move my computer around just a little bit here. Yeah. Okay, that's a little bit better. Let's see here. I have a couple things that I want to talk about today before we get started with our main questions, though. So let me set this computer up just correctly. Hello, Susanna. Oh, you're new and waiting for a diagnosis. Well, my dear, we are going to help you and maybe give you some questions that you can use with your doctor as you ponder your new treatments. I'm so sorry. On the other hand, I get to say you are absolutely not alone. There is hope, my friends. Hey, listen. 20 years ago, 30 years ago, 40 years ago, we pretty much all thought that IC was incurable and it was a bladder disease and yada, yada, yada. We don't think that anymore. Now we really focus on IC as injury or trauma to not only the bladder, but potentially to other structures in the pelvis. We have come so incredibly far in our understanding of IC since I've been a support group leader for the last 25 years. Let me just introduce myself. My name is Jill Osborne. I am an IC patient. My first symptoms actually began in 7th grade. I did not have bladder pain until I was 32, though. I am the founder of the Interstitial Cystitis Network. We are a health education and medical publishing company dedicated to pelvic pain disorders. I have 3 college degrees, a degree in chemistry, a degree in pharmacology, and a degree in psychology. I always wondered why I ended up with those weird degrees, and now I know why, because they really work to run the IC network. And so I'm really, really happy about that. Hello, Alexis from New York. Hello, Julianne from Germany. Oh, it's so nice to meet you. Hello, Courtney. Very, very, very nice to see you. All right. So I have a couple of things that I want to talk about first, and we will eventually talk about the Elmeron eye stuff too. However, hello, Jerry from YouTube. Very, very nice. Very good to see you. Nice to see you. So my friends, it is September. It is IC Awareness Month. This is the time when we as patients gather together and tell our stories. This is when we look at our community and ask ourselves, are we treating IC patients and chronic pain patients correctly and nicely? And if they're not, we need to do something about it. And if not you, who? I have a really, I think if you've known me at all, you know that I'm pretty much a rebel, and I have been a rebel for a long time. I don't believe that IC Awareness Month is about promoting the IC network or the ICA. IC Awareness Month is about making you the star, because you're the ones living in your community. You're the ones who know if doctors are treating patients correctly. I don't know that. You're the ones who know that. And if you're not being treated correctly, then what we have to do is we've got to do some education. We have to do some education. And that's what ICAwareness.org is set up for. It's not set up for me. It's set up for you. It gives you resources that you can use to make change in your community. And, you know, one of my favorite affirmations is be bold and mighty forces shall come to thy aid. I want you to be bold with your IC outreach. I remember when I started my first support group in 1993. I started it in September 1993 here in Northern California. We had our first conference less than a year later. And I'll tell you, I took some heat from that. It's like, who are you to think you can do a conference? And it's like, hey, why not me? Why not me? I'm going to do it. We brought in some of the best IC experts in the world. We did a game-changing conference here in Northern California. I'd only been a support group leader for 9 months. So I want you to think big here. We can do a conference. You can contact your local hospital. Ask for the employee who does grand rounds. here's a big secret. You know, every month hospitals are required to put seminars on that doctors and nurses get credit for, and they need that to keep their medical license, right? When you actually talk to the person setting up their courses, they are frustrated. They are looking for topics. They are desperate for help. You can call them and say, hey, you know, have you ever heard of a condition called interstitial cystitis? I bet you haven't. I would like to propose a seminar. We can bring in an IC expert. Let's teach the doctors in your hospital, the doctors in your area about current strategies for dealing with bladder pain and chronic pelvic pain. If you are that bold, my friend, and you're really thinking of doing that, I want you to call me because I bet I can find a speaker for you. You know, we've got doctors who are very good advocates for IC. And so be bold, my friends, be bold. All right. So I was thinking about IC Awareness Month a couple of days ago going, God, like, what's the single most important thing that you as an IC patient can do to support IC Awareness Month? And it's really easy. If you could just print out the American Urology Association guidelines for the treatment of IC, I want you to print out 3 copies. I want you to print out a copy for you. I want you to print out a copy for your urologist. And I want you to save a copy for any other doctors that you might have to see. Why is this important? Because what we're seeing now, you know, now that the opiate crisis has happened and so many patients are being taken off of their pain meds or they're being referred to a pain doctor, right? So here you've got a patient with Hunter's lesions, really severe IC. They've been using opiate medication correctly for years, low doses, no sign of addiction, and they're now told that they cannot get their pain medicine and they've got to go to a pain clinic. And then you go to the pain clinic, and guess what? The pain specialists don't know what IC is. And worse, they tell patients, oh, come on, the bladder can't hurt that bad. You don't need pain medicine. Or, oh, come on, that's got to be all in your head. You know, I mean, that's happening right now. I'm getting phone calls about this right now. You know, it's astonishing to me the number of people who completely disrespect the IC patient and who simply don't have knowledge. So again, the single most important thing I think you can do for IC Awareness Month, and do it for yourself, but also do it for the other patients who might be running into that doctor, is give them a copy of the AUA IC guidelines. So how do you get them? I will have a link. Actually, there are many links on our website already in our diagnosis and treatment area, but you just go to auanet.org, auanet.org. In the upper right-hand corner is a link for guidelines. Click on that. Get onto that page, search for interstitial cystitis, print it out, my friends, print it out. That is a game changer. If you walk in with these guidelines in hand, no one can disrespect you. No one can tell you that IC is all in your head. No one can tell you that there's no treatment. So I want you to be an ambassador for the IC community. I want you to think about how you were treated, and let's think about the people who are coming after you, and let's make sure that they're not being disrespected. Alrighty. So that is what I think everyone should do, and what I hope you will do. 3 copies, 1 for you, 1 for your doctor, and 1 to have on hand if you have to see another doctor. Print out 5, pass them out. Pass them out. Why the heck not? All right. So, in honor of IC Awareness Month, I have a gift for you. Yes, yes, yes. Now granted, if you've already been to one of our support group meetings then last week, and we're going to do another one this Sunday, by the way. If you've already gotten one, please don't ask again. But I have IC Awareness Month bracelets for you. Right? Free. See? And they say, we stand together. IC Awareness Month. If you send me your mailing address I'm going to send you an IC awareness smith bracelet and our new diet card, right? And the first 10 people are also going to get our latest magazine, the IC Optimist. So where do you send your information? I want you to send it to icnetwork@mac.com. And you would think that I would have this written down, and of course I don't. I did. Where is it? Okay, hold on. Let me write it down for you, my friends. Let me write it down for you. I think we'll use green today. Green is my color today. All right, here's the email address, icnetwork@mac.com. Send me your mailing address, even if you're in another country, even if you're in Germany, and I will mail you an IC awareness bracelet and our food list. And the first 10 are also going to get copies of our summer magazine, because I just got copies of our summer magazine. All righty then. Hello, everybody. Let's see who else has come in. I have a little mini lecture that I want to give on urethral burning, but let me just take a couple questions first. So over on YouTube, Sandy says, so glad to see you. I've had Hunner's lesions for 11 years. Oh, so, you know, it's funny. I was talking about Hunner's lesions yesterday with a patient. Hunner's lesions are a bit of a mystery because, you know, we've got guesses as to why they happen. We've got two, I think, very, very strong theories as to why Hunner's lesions happen. First of all, let me just say that Hunner's lesions only affect 5 to 10% of the patient population. And they're characterized by profound areas of bleeding in the bladder. They used to be called ulcers. We now call them lesions. It doesn't really matter if you call them an ulcer or a lesion. What we do know, though, is when you biopsy a lesion, it is filled with inflammation, massive inflammation. No other patient has this level of inflammation. Only Hunner's lesions have inflammation. So what does inflammation mean? Inflammation means that your body is fighting something. It's kind of a biological war in a way. It is the human body trying to control something that is going on. You can Google it. Just Google up inflammation. You know, generally, inflammation after an injury is kind of a good thing because it means that your body is sending white blood cells to the area and it's trying to fix it. But then chronic inflammation happens. Chronic inflammation is not a good thing. So there are kind of two theories with Hunner's lesions. Theory number one is that it is a nerve that is massively inflamed. We call it neuroinflammation. And when nerves get inflamed, they release molecules, substances from their nerve endings called substance P. And substance P is actually quite damaging. So if you've got a nerve that is firing like mad, super, super inflamed, you get a lot of substance P irritation and inflammation in those tissues. And actually, look at this. I can actually give you, let me just show you something here. This is it from our summer magazine. I highlighted, I don't know if it's going to be that clear for you guys. In this magazine, I covered the American Urology Association pelvic pain course. And this is a graph that has been around for some time. It kind of talks about this loop of irritation that patients get into. So let's look at this for a moment, okay? So in this graph, what we have first is a bladder insult. So the bladder gets damaged in some way. And let's just say it's chemotherapy, because we know chemotherapy is very badly irritating to the bladder. So you've got a bladder insult, and then that causes damage to the epithelium, right? That then allows potassium and other substances in urine to leak into the superficial cells of the bladder wall. That then causes the activation of the C fiber nerves and the release of substance P. And of course, because substance P is very irritating, it then causes mast cells to release histamine, which then causes more injury, which then goes back to more bladder injury. But look at this little reverse thing here. So you've got the injury, the nerves are getting irritated, substance P is being released, mast cells then get stimulated and release histamine. And look, we've got a loop back here. As histamines are released, nerves get more irritated. As nerves get more irritated, substance P is released. And you get stuck in this vicious cycle right here of irritation. Now, the cool thing about this graph is it kind of gives you a clue as to treatment. And I'm sorry, I'm not holding that clearly. For epithelial damage, hold on. For epithelial damage, what they say is use a bladder coating like Pentosan. Of course, now we have issues with Pentosan. If the nerves are super irritated, we want to use a tricyclic therapy like amitriptyline or maybe gabapentin. If the mast cells are involved, we want to use an antihistamine. Okay, again, that's all in this summer magazine. So, you know, people ask, well, why do we have as common treatments for quote unquote IC, Elmeron, a bladder coating, Vistaril, an antihistamine, and amitriptyline, an antidepressant? And that's why we want to coat the bladder, we want to calm the nerves down, and we want to calm inflammation. So getting back to Hunter's lesions, you're in kind of the more difficult scenario because you have a bigger wound, right? So you're going to be even more stuck in that cycle potentially. So again, theory number one about Hunter's lesions is we got massive neuroinflammation. Theory number two about Hunter's lesions is that we now have 3 research studies that suggest there could be a viral infection in patients with a Hunter's lesion. We've linked polyoma BK virus. That is a virus that is complete. We all have it. It's part of the normal urinary biome. Every single person has it. It normally lives very quietly in the urinary system unless that patient becomes immune compromised. That's when it gets turned on. So polyoma BK has been linked in many, many research studies to hemorrhagic cystitis. Just 3 months ago or 4 months ago in May, whenever that was, we had our first research study that linked Epstein-Barr. We also know that the human papillomavirus, we know that herpes, these are all, think about it, 25 years ago, I had no freaking clue that you could have a viral infection in your bladder. And so I was funny. I'm writing a chapter for a new book on IC, and we keep writing and then we want to expand, and writing and we want to expand. And it's all about the subtypes, right? So I emailed a friend of mine in Europe, and because I was going through the European Society IC guidelines, and I kind of had discounted those over the years because, at least in America and Canada, they don't really work because they require hydrodistensions for everybody. And we just don't do that here. Our insurance companies won't do that. But it's going back through and reading them again. And I noticed that they screen for viral infections. They screen for bacterial infections. They screen for viral infections. So I emailed her and I said, so when you find a virus, how do you treat it? And she goes, nobody's really asked that. So then she emailed the best urologist in Europe for this. And his answer was suitably vague, which is, well, we take it on a case by case basis. So just kind of know that, again, with Hunter's lesions, while the research is unsettled, you have a goal. Your goal is to protect the wounds in your bladder. Your goal is to calm and soothe the wounds in your bladder. And your goal also is to treat the lesions, because we know when we treat the lesion and we silence the nerve, the pain usually goes away and the lesion can go away. We have the first treatment in history that has healed lesions completely in 2 weeks. It's called Liris, L-I-R-I-S, Liris. Imagine a soft, hollow piece of spaghetti filled with lidocaine. They created it to fight pain in the bladder. They were stunned, the first research study to find that Hunter's lesions healed. So what is the medicine in Liris? Lidocaine. What does lidocaine do? It turns the nerves off. So isn't it interesting that if you turn the nerve off and you silence the nerve, the lesion goes away? So again, kind of warring theories, but we've learned so much more, Sandy, so much more. I want you to carry hope in your heart. Come to our website, read that section on Hunter's lesions. And if you have any questions, you are always, always, always welcome to give me a phone call, 1-800-928-7496. Sandy also says here on YouTube, she said that she's cut out sugar and it's made a huge difference for her, or made a difference. Yeah, that's something that I flirt with too every now and then. And it's really hard to cut out sugar. I try not. I don't eat candy. I rarely eat candy or anything like that. But, you know, guys, I mean, that does raise a really important point, and that is that our diets are so screwed up. They're so screwed up, and there's not, you haven't screwed them up. The food companies have screwed them up. You know, they are putting so much sugar and so much preservatives, and it's all about shelf life, and they want products to last longer. And so we got massive levels of you know, like bread, you know, tends to have a lot of preservatives in it. Cereals tend to have a lot of preservatives in it. And why do they put sugar in everything? Because, hello, it triggers the brain. It makes you crave more sugar. It's called a sugar addiction. They have every intention of wanting you to become addicted to their product because they want you back over and over and over again. Some very good videos on that. One of the big beefs that nutrition advocates have is the use of chocolate milk in schools. Schools for decades served regular milk. And then the chocolate industry wanted a new market. So they approached schools and said, so if you want kids to drink milk, give them chocolate milk. And the schools were like, great. What the schools didn't understand is that chocolate milk has lots and lots and lots of sugar in it. So there was one, I don't remember the name of the documentary, but they were saying that by 6th grade, those children have now consumed like a wheelbarrows full of sugar. We didn't have that. No, did we? No, we had chocolate milk when I was a kid. I think it started like around in the 60s. So anyway, I agree with that. If you can take sugar out of your diet, but you know, don't starve yourself. Like I have a little tiny bit of rooibos tea right here. I just like a half a teaspoon of sugar in it. I don't put 3 tablespoons in like I used to. Tiny, tiny bits. Okay, and so guys, please feel free to ask questions. Jerry says, are restless legs connected to IC? Not directly, but we certainly have had a few patients report that they struggle with restless legs. Miranda says, can you suggest for someone like myself who has a gene that rapidly processes pain meds? They do nothing for me. You know, I want you to read the AUA guidelines, Miranda, because the American Urology Association is extremely compassionate about pain care. They want pain assessed at every appointment. They want it treated compassionately and aggressively. And they support the use of opiate medication, but they also want you to use a multimodal approach to therapy. So what does that mean? That means we need to use as many different things as we can that will help to address your pain. And so, you know, our goal here is to treat whatever's hurting And if we can heal that, then you don't even need pain medicine in the first place. So, for example, we find a lot of patients with recurring pain who have untreated Hunner's lesions. And if you treat the lesion correctly, the pain usually goes away. We see a lot of patients who have extremely tight muscles. I was working with a ballerina, a young ballerina, but she started dancing when she was 4 or 5, and she's now in her early 20s. And her pelvic floor is over the top tight. It is like agony for her. And we're trying to find the best doctor and the best physical therapy team for her because her muscles are so incredibly dysfunctional. Does she, and once we can get those muscles rehabilitated and relaxed, will she need pain medicine as much? Probably not. So Miranda, what can you do if you have the gene that rapidly processes it? Girl, you gotta, number one, focus on your anatomy. Let's make sure we understand what you're treating. If it's muscles, you got to do physical therapy. If it's muscles, you want to do a muscle relaxant like I did last night. I took Flexeril last night because I've been having levator spasms for 2 days. Very frustrating. If you've got Hunner's lesions, you got to initiate the discussion to get that treated. But I would look at over-the-counter stuff. I would look at, on our website, we sell Proserona and NeuroQuell. And I think, hold on. They come in little tiny tubes, little tiny glass vials. It's an essential oil of the marigold plant. It's invented by the Endometriosis Association to help women with endometrial pain. Clarelyn Topicals is the manufacturer. Using something like an essential oil might actually be helpful for you. I use a ton of Tiger Balm myself. I'm like slathered with Tiger Balm every morning because I've got this constant left side SI piriformis levator problem that is going on. I would look at medical marijuana. Medical marijuana is really good for relaxing muscles for some patients. You could also, if it's nerve pain, you could look at maybe, well, we can't, I don't know if your gene will process gabapentin the same way, amitriptyline the same way, something like that. It's a good question, hon. If I could give you a hug right now, I would. I know you're struggling. I know you're struggling. Elena says, is there anything for frequency? She has no pain, no blood, just feeling pressure all the time. You guys, you got to remember that frequency is coming from the alpha afferent nerve in the bladder wall. And let's see if I can find my little. All right, where is it? You would think I would have my office. Actually, my office is set up beautifully for this meeting. Darn it. All right. Come here. Okay. So let's explain where that frequency is coming from. So this, my friends, is your bladder wall, right? So at the top of your bladder, and I always like to say this, what makes the bladder such an interesting organ is it's the only organ in the human body designed to hold toxic waste, because urine is body waste. Urine is ammonia and urea. It's got lots of irritants in it. It's got the byproducts of chemicals that you're exposed to. If you're a smoker, there are thousands of irritating byproducts from the smoking, which is why smoking is the #1 cause of cancer, bladder cancer. Okay, so how does the bladder protect itself from all those irritants? And the answer is your bladder is like your mouth. It is a hollow organ covered with mucus. And it is that nice, moist, mucosal barrier that protects your bladder wall. Okay? So let's look at this diagram for a moment. So here we've got this blue area is your mucus. Underneath that, you got your urothelium. You've got the cells of your bladder wall. And then underneath that, we've got nerves, the green nerves, and the blood vessels. Interesting geeky fact about the bladder is the bladder has the largest single cells in the human body. These cells, they're huge. And because they're so big, it takes 2 weeks for one of them to be replaced. So why do you have frequency? The frequency is coming from the nerve. We got two core nerves in the bladder. You've got the alpha afferent nerve and you've got the C fiber, which is the pain nerve. The alpha afferent nerve is the nerve that is the first nerve that gets turned on when your bladder wall gets irritated. And it is generally the last nerve that gets turned off. Why? Because it's easy to turn on. It's the nerve that you use all day that tells you when you need to pee. So again, first nerve that gets turned on when your bladder gets irritated and the last nerve that gets turned off. So if you are having discomfort as your bladder fills with urine that is relieved by urination, you feel better after you pee, that is your alpha afferent nerve. And so what that tells me is that there is something in your daily diet that is irritating these cells and irritating these nerves. There's something in your daily life, and or maybe you're menopausal. And when you're menopausal, unfortunately, this mucosal barrier is estrogen dependent. And so when you're young and you have lots of estrogen, you have lots of mucus. When you're older, you have much less estrogen, therefore you have much less mucus. So that means that your bladder's ability to defend itself is reduced. So I am in my 50s. I do not have the bladder coating that I had in my 30s, period. So the foods that I might have been able to eat back then, I might not be able to eat now, not just because of IC, but because my bladder simply cannot defend itself. So Elena, I would ask you to let's revisit what you're doing on a daily basis and see if there's something irritating in your diet that's causing that. Aside from the typical high acid foods, coffee, soda, yada, 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 you already know that, orange juice, green tea, chai tea, all that sort of stuff. The two hidden irritants are often multivitamin. If you take a multivitamin, those are well known to be irritating unless you do a low acid vitamin. And or drinking alkaline water all day. We do not support drinking alkaline water all day. I believe that is a terrible mistake. Your goal is to drink spring water. And you also have to be really careful with filtered water because some filtered waters take out too many minerals and you end up with acid water. Alrighty. So let's revisit your diet. Let's just see if there's anything else on a daily basis that might be provoking it. If you feel worse after you're done peeing, then we're going to look at your pelvic floor instead, potentially as being the trigger for that. Deborah on YouTube was wondering if anybody has issues with Celebrex. I don't know off the top of my head that question. Jerry says, what soothes your bladder? What soothes your bladder are things that are called that. I was going to say calming and soothing. What is your bladder designed to hold? Water. Water is soothing. Hot water is soothing. Chamomile herbal tea is soothing. Maybe peppermint herbal tea might be a little bit soothing. Desert harvest aloe, something like this, can be soothing, right? The other thing you could do is you could actually cover your bladder wall with a bladder coating. In fact, this is a educational postcard created by Elmeron. And so if you look at it this way, here's somebody who's missing part of their coating, thus urine is getting in there. And Elmeron is a bladder coating that protects these tissues so that urine can't come in there. So the concept of a bladder coating might also potentially be helpful for you. Unfortunately, we do have new research that has linked Elmeron to macular damage. And we'll talk about that in a bit. Alrighty. So most people the American Urology Association says, start at step one, start with the supplements before you go to Elmeron anyway. So you could try some of the bladder coating supplements like Cysto Renew and or Cysto Protect. And I'm really excited to tell you that we're working I'm working for the first time with a company to design another supplement that will be slightly different, but I think better. So we might even have another supplement in a couple of months if it passes the Jill test, which means I've got to take it and be okay with it. along with a few other people. All right. You know what I want to do is before we take any more questions, and again, please feel free to ask questions. Wait, Lynn on Facebook says there's a new show on Lifetime on Sunday nights called You, and the main female character's friend had IC, and she talked about being in pain. Oh, that's very cool. I would like to see that. Christy asked, can you have fibromyalgia and IC together? Sure. Sure. Fibro is kind of a related condition to IC for some, but not all patients. The email address, Angie, is icnetwork@mac.com. ICNETWORK @Mac. M as in Mary, A as in Apple, C as in Charlie.com. All right. I want to talk about something very briefly before we take more questions. Alrighty. So I will tell you at least once a week, if not more, I get a phone call from somebody with screaming urethral pain. Like their urethra is on fire. And they ask, is that part of IC? And the answer is not usually. IC patients usually don't have a lot of urethral stuff going on. You know, with IC patients, I ask the question, when is your pain the worst? Before you pee, while you're peeing, after you're done peeing. If you are bladder wall driven, your pain is going to be before you pee. If you are pelvic floor driven, your pain is going to be after you're done peeing. If you have pain while you're peeing, that's sometimes different. So we know that burning during urination is really strongly associated with bladder infection, right? But there are other potential causes. So I just thought I would take a moment and go over some of the things that we know that can trigger urethral pain. Number one, you've all been there. Anytime somebody puts an instrument in your bladder, that's going to hurt. I mean, in your urethra, that's going to hurt. It's absolutely notorious for patients to have discomfort at least for 24 hours after you've had a rescue installation, anytime you've been catheterized, anything like that. That pain is very short term. Usually it's gone in 24 hours. So that's not, it's usually not worrisome. I will tell you, when I was in 7th, 8th, and 9th grade, I had about 100 urethral dilations, and it happened every single time. That first pee afterwards is like, you know, you just kind of have to grit your teeth and, you know, it's hard. It hurts. But the good news is the second time you pee, it's better. The third time you pee, it's better. And usually within 24 hours, it's much better. For me, I will tell you what I do is I just drink a really big glass of water so that I have a lot of volume in my bladder, so that when it's time to pee that first time, I just bite my lip and pee it out. Find stopping and starting kind of makes it worse. Sometimes you just have to bite your lip and go. Alrighty. So very normal to have urethral pain after you're catheterized. It's also very normal to have urethral pain when you have a bladder infection of some type. And of course, if you do think you have infection, you want to use an azo test strip, which I have a sample of somewhere. Here we go. Many IC patients, myself included, you spend the first year assuming every time you have a flare, you've got an infection. How many? I mean, I swear we have made these lab companies rich with all the urine testing that we've ordered, and we've exhausted our doctors. Even though our doctors sometimes are saying there's no infection, it feels like infection. So, you know, your first offense is to do an azo strip test, right? You can order these at home. So if you think you have an infection, do one of these. Azo test strips test for two things. They test for leukocytes, white blood cells, and they also test for nitrites. If you have a double positive or a positive nitrites, you have infection. Call your doctor. All right. The third thing that's going to irritate the urethra is your hormones. What happens as we get older is, again, because mucous membranes are hormone dependent, they're estrogen dependent. So when you're young, you have lots of estrogen, therefore you have a lot of mucus in your bladder and in your urethra and on your vulva and in your vagina. However, when you're older, you have less. And one of the first areas of the urinary tract to react to the loss of estrogen is, in fact, your urethra. So it's quite normal for women to go through a period where they have urethral discomfort. I did. It felt like I was like 52 at the time, and it felt like I had a drop of urine in my urethra that simply would not come out, and it was very irritating. And and listen, my self-help skills for IC are really good, and yet nothing I could do would make that urethral pain go away. And so 3 months later, I finally went to the urologist and said, "Why is my urethra screaming like this?" And his answer was, "Jill, didn't you use a hormone cream I gave you last year?" And my answer was, "No, I didn't think I needed it, because in my brain, I'm 25. I wasn't over 50. For God's sake, I'm still 25 here." And he explained that the urethra is often the first area to react to the loss of estrogen. So the solution was to use a little pea-sized drop of estrogen at the tip of my finger and rubbed it at the entrance to my urethra. Within a week, it was gone. If I forget to do it for about 10 days, it comes right back. Another thing that can irritate the urethra is, in fact, an infection of your if you're a woman, your periurethral gland. So your urethra is like the size of your little finger, right? It's really only 2 inches long, 2.5 inches long. Halfway up on the outside of your urethra is a gland that is the equivalent of the prostate gland. In fact, testing has found the tissue is identical to the male prostate. So women have a prostate gland called the periurethral gland. And like a male prostate, this gland easily becomes infected. And because the drainage ducts are so tiny, it becomes like a deep stagnant pimple. And so if you notice pain, if you're having sex at the moment of penetration, that is usually, if it's one specific spot, that's usually an infection of this little tiny gland. You can tell you have an infection of this gland if you stick your finger in your vagina just about an inch. Obviously, wash your hands first, put on a glove, whatever. Just insert your finger about an inch and rub the front side of your vagina. And because that's where your urethra is, right? And if you feel what feels like a deep pimple, a deep painful pimple, that, my friends, is an infected periurethral gland. So that's something that can happen. And treating these glands are hard because you have to drain them. And of course, how do you drain them? Because you can't, when we have a pimple, what do? We squeeze it, right, to get it out. Well, with these glands, what they have to do is they've got to put a finger in your vagina and maybe something in your urethra, and they kind of mush them together to kind of get it to drain. Not the funnest thing in the world, but very doable. I will tell you also what's so interesting about those glands is they are often filled with biofilm infections. And what's so cool about a biofilm is that it is a heterogeneous population of bacteria. It's not just one bacteria. It's a whole bunch of bacteria living together. We're learning so much about biofilms now, and I'd love to do a whole lecture on that in the future because they are organized in a specific way. They're really smart. Those bacteria are really, really smart, and they're kind of outsmarting us. The fifth potential cause of urethral irritation is, in fact, a very tight pelvic floor. Because again, if this is your urethra, you've got muscles, that go that's supported on all sides. And if those muscles are tight and they're squeezing on that urethra, it's going to be hard for you to pee. And so we are always going to look for pelvic floor dysfunction as a potential source of urethral burning. We're also going to look at a chemical irritation. So the patient that I was working with on Monday or Tuesday was breaking a lot of rules for chemical irritation. She was using a fabric softener. She was using laundry sheets. Things that leave chemicals on underwear are really well known to then gas off the underwear and irritate your tender skin down there, especially if you're older and you don't have as much mucus. And in fact, in the class we took a couple months ago, the very first thing they said is get rid of all the chemicals touching you down there. So that means no fabric softener, no laundry, no dryer sheets, you got to be really careful with your laundry detergent. Use a free and clear. I use a brand called Planet. You can use a baby detergent, but be really careful with some other detergents. And last but not least, I think this is so interesting. It is, we're also seeing in some women irritation from their menstrual pads. Because as the pads have gotten thinner and thinner and thinner, how do they absorb what they're absorbing? And the answer is they've got a chemical layer in there to absorb fluid. Unfortunately, when that chemical gets wet, it off gases. And it happened to me with the new Always pads about 5 years ago. They came out with a new brand of Always pads. And oh man, it felt like my whole vulva was burned after I used it. And I went back to the old Always rather than the new Always. Okay, so there's my little scoop on what can cause urethral burning: catheterization, bladder infection, hormones, infection of the periurethral gland, pelvic floor dysfunction, chemical irritation, and the off-gassing of pads and panty liners. Everything you wanted to know, you just got right. I'm a geek. I like this stuff. All right, let's go back to some of your questions here. Mary is on Facebook. She said she never had a real diagnosis, but she had a doctor tell her that without testing about 15 years ago that she had IC. Her bladder had ruptured after a pelvic fracture and repaired via surgery. I spent years on antibiotics while the urologist never showed an infection, but he would keep me on antibiotics. I get triggered with foods, drinks, sex, gabapentin. So, again, we really need you to think about IC as injury or trauma. There's really only two areas where we see a, quote, disease process, and that is in Hunner's lesions and or somebody with a chronic infection, a tiny subtype of IC subtype 2. Mary, you are the perfect example of someone who sustained a traumatic bladder injury. And bladder ruptures, I'm not going to say are common, but they certainly do happen. They can happen, for example, if you're playing soccer with a full bladder and you get hit in the belly with a ball, that's been known to rupture the bladder. Also, we certainly have cases where children driving across the country, mom or dad won't stop at the bathroom, the bladder gets very full, and we've certainly had numerous patients, children and adults, whose bladders have ruptured because they have not had access to a bathroom. We also see bladders that have ruptured after hydrodistension if they fill the bladder too much. And that is why we now do low pressure, short duration distensions rather than high pressure, long duration to minimize the risk of bladder rupture. So we know then that your bladder was surgically repaired. We know that you experienced severe pain because of your bladder injury, no doubt about that. We also know that your pelvic floor muscles had to be involved. They were either injured in the accident, or even if they weren't injured in the accident, because you sustained terrible bladder pain, they got very tight because of that. And so the one thing you can count on is that healing is always happening. The odds are your bladder, the original bladder incision, is completely healed now. Might be a little scarred, but it's probably healed. It would be really difficult for it not to be healed after 15 years. The human body is wired to heal itself. That never, ever stops. So people, listen, if you fail and skin your knee, you'd have a scab on it tomorrow. That's the healing process in action. The legacy that you're probably dealing with is very tight muscles and or the consequences of long-term antibiotic use, because you say here that you were on antibiotics for years. And it would be fascinating to maybe do a next generation urine test to really see what's in your bladder now. I mean, because you say you never had infection, but he gave you antibiotics. So there's a chance that you could have maybe a little bit of a chronic candida infection. That would be a very interesting piece of the puzzle to explore, in my opinion. But you do say you get triggered with foods, drinks, sex, and stress. So the foods imply that your bladder is a bit sensitive. The drinks imply that your bladder is sensitive. The sex implies that your pelvic floor is tight. The stress implies that your pelvic floor is probably tight. You also have to understand that that was 15 years ago, and you're older now, and your estrogen levels might be lower, and that might also explain why you are more food sensitive today. So I'm so sorry that you went through that tremendous trauma. And I'm so glad that it's well behind you. And our goal now is to try to get you feeling better. And so you need to be, if I were you, I think you're stuck in the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor? For some people, it begins with a bladder injury, and then so here's your bladder, and because your bladder's injured, it's kind of pulsing and screaming, and so here's your pelvic floor, and your pelvic floor is going to get tight to protect you. That's called the guarding reflex. So our goal in this case is to calm and soothe the bladder, because when we calm and soothe the bladder, the pelvic floor should relax. But let's look at the other reverse scenario. Maybe your symptoms began not just because your bladder was injured, but because your pelvic floor was injured. So your muscles are now were weakened because they were hurt, and they had a job to do, which is to support the organs. But because they were weak, they had to struggle. They started to struggle, and so they started getting tight. So they started squeezing. It's completely involuntary. It's what I'm dealing with right now after a freaking hysterectomy last year. Like the last 2 days, this is what's going on with me. So your muscles get tight. And because your muscles get tight, your bladder's just not getting the nutrition that it needs to be healthy. It's not getting the oxygen. It's not getting the nutrients, all that sort of good stuff. So for these patients, we could throw every bladder treatment in the book at them, and they would not get better, because the underlying problem really is terrible blood flow from very tight muscles. So for these patients, our number one therapeutic goal is to restore blood flow. How do we do that? We relax the muscles. When we relax the muscles, the bladder starts to get the nutrition it needs, the blood flow it needs to heal. So Mary, if I were you, I would want a pelvic floor assessment to see what's going on with your pelvic floor. All righty? Christy asked, have you tried mushroom root? No, I don't know what that is. Or she's probably asking somebody else that. Somebody on Facebook says that they also had restless leg syndrome, and they took vitamin D. They did not know that they had a vitamin D deficiency, and when they restored their vitamin D levels, the restless leg went away. Somebody else says they've got restless leg from a neuropathy rather than vitamin D. Angie says, that's my pelvic floor. I completely lock up. Yes, yes. So frustrating. Hello, Donna. Hello, Carol. Hello, Nancy. I'm just going through questions right now on Facebook. This Robin says her allergies are on overload, and that seems to be irritating her bladder. That's very common. Again, if you remember that graph I showed you a little bit earlier, mast cells release histamine. Histamine causes more injury to the bladder wall. And so during allergy season, your mast cells are much more active. Dr. Lowell Parsons had a name for it. I forget what it was, but it's well known. In fact, they talked about it at the class on IC, and they recommended that, let me see if I can find it. Patients during allergy season, they recommended upping your antihistamine and or adding let me see if I can find it. They had another medication that they suggested adding during allergy season. Oh, here it is. During allergy season, they suggested increasing the dosage and or using Montelukast, 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 especially in patients with a history of asthma. They also said an H2 blocker like cimetidine might also help patients who struggle with GI symptoms. Some people share that they got sick with Elmeron. The Elmeron didn't help. Elmeron is certainly not the only act in town. It's not the only IC treatment. And of course, now we have research that shows that Elmeron may be linked to eye damage. So a lot of people are reconsidering Elmeron at this point. Betsa says, when I walk, my gluteus hurts. It tingles in the legs. Is that part of the bladder pelvic? That's part of the pelvic floor. I have the same thing. You know, at least for me, when my piriformis starts getting tight or my glute gets tight, I get a little flickering, like a little tiny woo, you know, it's like you're sitting on a cell phone on vibrate, which started last Friday for me. And then it gets bigger. And then it gets really, really big. It's like sitting on a cell phone doing a lot of vibration. And that's when I've got to whip out the muscle relaxant. I was talking with one of my physical therapists last week, and you know, I took a class. They went, you know, you're already way too fit for this class. This class is not helpful. And my answer back to them is, I just want to know. I just need a plan for when it starts to vibrate and tingle. Tell me what to do. And ultimately, it is the tennis ball on the floor rubbing, trying to break up that muscle line. All right, if you've got questions, please feel free to ask them. So Betsa, again, I believe that's pelvic floor lumbar muscle. Susan says, she ordered all 3 supplements this week, Sister Protect, Sister Renew, Aloe. Which one would I suggest you try first, since I'm so sensitive and I need to stop using Elmeron? So girl, I'm sensitive too, and I operate from a less is more perspective. There's a pharmaceutical concept called lowest effective dose. What's the least amount of medication you can take and still have a beneficial effect? I don't like taking medicine because, hello, I'm a redhead from Norway and I am the epitome of sensitive. I don't like taking medicine at all. So it's kind of a crapshoot. Most people usually start with well, okay, let me take this a different way. If you, how do I want to say this? Issue number 1 with supplements is aloe. Are you aloe sensitive? There are some people who are very sensitive to aloe and it gives them gut distress. So if you have taken aloe before and your body's fine with aloe, I would suggest that you start with this, Sister Renew. I think this is for the best bang for your buck because it has 4 potential methods of action. It has chondroitin for a bladder coating effect. It's got quercetin for an antihistaminic effect. It's got a little bit of aloe for the soothing effect of the aloe. It's got a little bit of lemon balm, which is a mint with a lemony scent. This is not citrus lemon. It's known for calming nerves, a little bit of magnesium. So this one has the most methods of action, and I think will have you've got more of a chance of one of those mechanisms potentially helping you. But again, it's got a little bit of aloe in it. So if you're sensitive to aloe, then we don't want you to start with this one. I am of the position with any supplement, again, we cannot tell nobody can say what's going to work for you. It is a crapshoot. Whatever you do, you have to start slowly. Just take one pill, one capsule, wait 24 hours, see if your body likes it. If your body likes it and you're not having any adverse events, do one a day for a week. See if your body likes it. If it likes that, go to 2 a day. And you can work your way up to the manufacturer's recommended dose of 4 a day, which is usually 2 in the morning, 2 in the evening. I will tell you, for me, I never got past 1. When I went to 2, it gave me a loose bowel. So when I take a supplement, I take 1 a day. Now, the cool thing about that is this bottle will then last 4 months, which is great. That's a nice price point. You know, I don't come from a more is better perspective for those of us with sensitivity. It's also worth noting, and I think this is a cautionary note, that there are some people out there who eat pre-leaf like candy. Pre-leaf is an acid reducer. It doesn't do anything with your bladder, but what it does do is it has calcium in it that will minimize some of the acid. You cannot take it like candy. If you take too much, you're absorbing a lot of calcium, and that can contribute to other issues. So it's about being modest with whatever supplement you're using and going very, very slowly. So this one has multiple methods of action. Cystoprotect, which has long been kind of the top supplement, has 2 methods of action. It's got kind of a bladder coating effect from chondroitin and hyaluronate, and it also has quercetin in it. Most people think that the glucosamine is fairly meaningless in supplements for the bladder. It's really the chondroitin that's the important ingredient. This was the top dog for 15 years before this came out. This is kind of the top dog now. The doctor who invented this one, Dr. Theo Herides, a federally funded, National Institutes of Health funded IC researcher at Tufts University, it was very interesting. He's a pharmacologist. He teaches at medical school. He's kind of a geek's geek. Lovely, lovely, lovely man. I've known him for many, many years now. He was asked by his state to investigate the safety of supplements. And again, he is a scientist. He is a geek's geek scientist. And as part of that work, he became very intrigued. And it's like, as he was learning about chondroitin and all these other things, he started asking himself, I wonder if those would be helpful for the bladder. And the data that he got was so powerful for him, he decided to create a supplement to see it out. And so he's the one that created Cystoprotect. And it very, very quickly, he did an early study, 6-month study with hundreds of patients. They had a 55% success rate. It was published in the Canadian Journal of Urology. And this one very quickly, became very, very popular. Unfortunately, it's an old formula. I mean, it's 15 years old, and we've learned a lot about the bladder since then. Dr. Theo has moved on to autism. He's working with other diseases. So he's also in a licensing agreement with this, so he cannot compete with this. So he cannot or is not creating his next generation supplement. This was created by a new doctor, Dr. Gio Espinosa at Tufts, not at Tufts, he's at NYU. He's the director of integrative urology at NYU in New York City. He created this one about 5 years ago. So this really is kind of the next generation supplement. And then, of course, we have Desert Harvest Aloe. Desert Harvest Aloe, this is the only supplement company that's ever done a double-blind placebo-controlled study. And again, extremely soothing for the bladder and soothing for the urethra. Many, many patients have used this pretty successfully. But again, we have that kind of aloe tolerance issue. There are just some people who don't tolerate aloe as well as others. And then we also have Cysta Q or Cysta MD, and that's for patients who it was the first supplement really developed 20 plus years ago. It does not have a bladder coating effect. It's got quercetin for the antihistaminic effect, with a couple of other, herbs in it that are, it's really the quercetin that's the issue. That's the one that patients go to who are aloe intolerant and or who shellfish intolerant. So those are the 4 right now in terms of the supplements. And again, it's kind of a crapshoot. You just kind of have to pick one and give it a shot. What's hard is that there's really no sampling programs available. Samples really are not available anymore because they're just too expensive for manufacturers. So it is going to be a $40, $45, $49 experiment. I will tell you that we are working on a new supplement. My goal with that new supplement is to get it under $40 to make it affordable because money is so tight for everybody, myself included. All right, let's keep going with questions. So Julie said she transitioned from Elmeron to Cystoprotect and that her symptoms were pretty bad while she was going through that transition. What Dr. Theo said at a conference, an IC conference in San Diego, where he was appearing with Dr. Parsons. So you got the guy who invented Elmeron and the guy who invented Cystoprotect standing side by side on a stage. And so the suggestion, if you wanted to try to swap, was a one-on-one change. So if you normally take 4 Elmeron, what they said is, well, reduce 1 Elmeron and add 1 Cystoprotect for a week, see if your symptoms change. If they don't, then okay, then losing that little bit of Elmeron isn't necessarily going to be an issue. They then said to go to 2 to 2. 2 Elmeron, 2 Cystoprotect, and then 1 Elmeron, 3 Cystoprotect to do that gradual transition. And, Dr. Parsons appeared, the guy who invented Elmeron, and in our lecture series, and one of the questions that he got is, will I have to take Elmeron for the rest of my life? And his answer was, no, absolutely not. What you have to find out is is it helping you? So how do you do that? And he said, same thing, reduce the dose gradually. If you're taking 4, go to 3. See if your symptoms change. If they don't, go to 2. See if your symptoms change. If they don't, go to 1. See if your symptoms change. If your symptoms never change, you reduce the dose, the Elmeron's clearly not helping. If your symptoms do change, that means that a bladder coating effect is potentially helping you. But of course, now we know, we have, as of earlier this month, we now know that the long-term use of Elmeron may be linked to retinal damage. And so we still don't have a statement from the company, from Janssen Pharmaceuticals, who manufactures it. We do not have a statement from Dr. Parsons, the man who invented it. But what we do know is that we have researchers from the Emory Eye Center at Emory University who believe that they have now found a new form of retinal disease that is based upon the long-term use of Pentosan. And in fact, I just had an email from somebody yesterday. I mean, we're getting about once a day, once every 2 days, again, being contacted by patients who are saying, thank you, you may have just saved my vision. We were trying to figure out why it was deteriorating. And the woman who emailed me yesterday had been on it for well over 20 years. And her eyesight was also diminishing fairly quickly. And she brought the article to her ophthalmologist, and she indeed had been diagnosed with pigmentary maculopathy. So that's changing. And if we have more questions on that, I'm happy to read out loud the letters that began this whole discovery. All right, let's keep going to your questions. What is the best way to be diagnosed with pelvic floor dysfunction? It's a 2-step process. Number 1, you go to your urologist, you go to your gynecologist. It's a quick, literally 10-second exam. All they're going to do is stick their finger up your vagina, or if you're a man, up your rectum. If you're tight, they're going to send you to a physical therapist. That physical therapist is then going to do a proper pelvic floor assessment. It takes about an hour. what they're going to do is study you externally. They're looking for patterns of muscle tension. They're going to look at your legs. They're going to look at your glutes. They're going to look at your core. They're going to look at your hips. They're going to measure your legs, see if you've got one leg longer than the other. Then they're going to do an internal exam. And that internal exam, they're just going to touch muscle groups. They're going to just there, left to the right, low, high. Your pelvic floor has 3 layers to it. So if we look at this, we got 3 knuckles, right? You've got shallow muscles, you've got medium muscles, and you got super, super deep muscles. So they're going to test the shallow ones, the deeper ones, and they're going to touch the deep ones. And based upon that, they're going to now be able to tell you which muscle group is the type muscle group for you. Guys, seriously, you have to go at least once. You cannot figure it out on your own because you don't know, even if you stick your finger up your, you know what, you're not necessarily going to know where the muscles are. And yes, if you can't afford physical therapy, I understand that. But if you can, just try to go once for the pelvic floor assessment. It'll be worth that couple $100 for that examination. Our goal is to walk out of that meeting with the names of the muscles that are tight. Then you can take that name and refer to one of the books or go to YouTube. So we've got a couple of books that are really good for people with pelvic floor. Ending Female Pain. Fabulous book. You'll learn more about your pelvic floor 5 minutes reading this book than any other book. Ending Male Pelvic Pain for Men. Fabulous book. The newest IC book is the Interstitial Cystitis Solution, written by physical therapist Nicole Kozian, who was the 2017 Physical Therapist of the Year last year as part of IC Awareness Month. Let me just say, guys, I need your nominations for IC Awareness Month: Doctor of the Year, Nurse of the Year, and Physical Therapist of the Year. Please go over to icawareness.org and nominate your doctors if you think they're treating you well, because they deserve our recognition. Okay, so this is another book that we would recommend. You notice they're covered with Post-its because I go over these books with a fine-tooth comb as I'm trying to understand their perspective. I wanted to see if I could show you a picture. Not to be, I know, guys, listen, we're all adults here. Hopefully we can take a look at anatomy and not be, grossed out by it. But this just kind of gives you a sense of all the different muscle groups, right? So we got some glute muscles here. I mean, these lower ones, or these are the ones that are spasming for me. You've just got this whole blend of muscles here. You'll never be able to figure out on your own which muscle is the issue. You need somebody to tell you what it is. Then it takes muscle work. Listen, there are some of you out there who want a pill to make it better. You can't do that. Muscles require muscle work. There's no pill like Elmeron that's going to fix your muscles. Yes, you can take a muscle relaxant like I did last night because my muscles have been spasming for 2 days, but ultimately, it's about retraining that muscle. And that is muscle work. That is stretching, my dears. That is working hard, which I did yesterday and I haven't done yet today. Let's see. If you're looking for a physical therapist, on our website, we have a list of physical therapists that work with IC patients. It's a fairly small list because we only take recommendations from patients who are being treated well as if somebody wants to be on the list, I have to talk to them first, make sure they really know their stuff. Or you can go, we also have on our website other websites you can use to search for physical therapists. I love how much you guys are supporting each other. That is just so freaking cool. How do you relax the pelvic floor? You need to buy a book and look at it. One of the things that you can do that doctors say to do is, hold on a sec. Let's see. I don't know and of course, I'm absolutely not wearing the right thing, is squat down. But just put your butt on your tailbone, or put your heels on your tailbone. When you squat down, you're putting your muscles exactly where they need to be. If you squat down and it hurts, then that tells us that your muscles, there's something going on with your muscles, my friend, and it is time to talk to a physical therapist. I know early on when I just started doing these chats, there was a lady who came to the first one and I showed them that, and she came back the next week and said, but why it hurts when I do that. And if it hurts when you do that, that's when you work with a physical therapist to try to figure out why it's hurting. And don't keep doing it if it's hurting, for goodness sake, okay? I mean, there's good pain where you're working on a muscle, and then there's intense pain when you're abusing that muscle. So don't persist any muscle work that is causing you intense pain. You got to be slow and gentle, okay? And I'll tell you why. I had my pelvic floor physical, my first pelvic floor assessment, like in 1999, 2000, somewhere in there. And so she said that my muscles low were super, super tight because they were compensating for very weak muscles up here. And she said, okay, Jill, I want you to do 5 quick flicks and hold them for 10 seconds or 5 seconds. I don't want you to do more. Do not double it. Do not triple it. We have to go slow. These muscles take time. You got to be super, super gentle. And she read me like a book, because what I do, I went home and I tripled everything, gave myself one of the worst icy flares ever, and that taught me you got to be gentle with those muscles. Daisy said Elmeron made her lose 60 pounds and she hasn't taken it for 3 months and she's still losing weight. I have never heard that, Daisy. And I think I would be working with a doctor to try to figure out what could be going on. I'm not aware of Elmeron being associated with weight loss to that extreme. Sandy says she had the opposite. She gained weight on Elmeron. Daisy said she wasn't given a choice. She was either to be put on Lupron or put on Elmeron. Those are not comparable at all. That is so weird. Elmeron's a bladder coating. Lupron stops your hormones. You go on Lupron if you got endometriosis. It's so weird that they would force you to choose between the two when they're not related at all. That's odd. Amy says she's got Hunter's ulcers and pinpoint bleeding. She's having a bad flare right now. Everything you eat or drink hurts. Thought I had a diet figured out. Guess not. Think of going gluten-free. Okay, so again, Amy, number one, anytime you've got a sudden flare and you're in intense pain, just do your due diligence here. Test your urine just out of curiosity. Let's just make sure you don't have an infection, because I've had I've only had 2 infections in 25 years, but they were pretty wicked. And both times I thought they were flares, and I waited for 6 weeks before it actually dawned on me that they were infection. So out of an abundance of caution, you know what? Check your urine first. Let's just make sure that you might not have an infection. And with your Hunter's lesions, again, we want to focus on getting that lesion treated. So I would be talking with your doctor about what's going on with your Hunter's lesion, Hunter ulcer treatment. Because you have Hunter's ulcers, Hunter's lesions, you're going to have to be really clean with your diet. You can't do anything acidic. You should not be cheating at all in any way, shape, or form. Simple, fresh, healthy food. Come to our website to learn about that diet. And, there's a book called The Better Bladder Book. Let's see. Here it is. This was written by Wendy Cohen, a nurse, and this came out, when did it come out? I'm going to say 8 or 9 years ago. 2011. So Wendy is the first person to really take on gluten intolerance. And some people really do have problems with gluten. Not a lot, but I have never had a bladder flare from gluten. However, I feel much, much better when I go gluten-free. I don't eat cereal. I don't eat white bread. I keep my gluten intake very, very low. I eat no wheat-based pasta. I eat quinoa pasta, corn pasta. So I don't have any problem with you experimenting, trying a little bit of gluten-free. You know, go gluten-free for a week or two and see if that makes a little bit of a difference. You might want to consider getting this book. You can get it on Amazon. It's called The Better Bladder Book. And again, it's by Wendy Cohen, RN. You know, it's very individual. I did not test positive for celiac. I do not have celiac disease, but I am being completely truthful when I say that I feel much better being gluten-free. My favorite morning now is I do Bisquick gluten-free pancakes. I love Bisquick mix gluten-free pancakes. It doesn't bother me at all. I make Bisquick gluten-free biscuits and muffins. And so I like playing with those gluten-free mixes. Some of them are good and some of them are terrible, but why not? Why not give it a shot? Karen says, why do we suffer so much? I can be holding just a drop and be in agony. You know, Karen, that's, again, it's all about your subtype. Not everybody is the same. There's tremendous diversity in the IC patient population. Some people have bleeding, bloody bladder walls with Hunter's lesions, like Amy, who was just writing on Facebook here. Others, like myself, I have an entirely normal bladder wall. Both of us are diagnosed with IC. Both of us have had very severe pain, yet clearly we're not the same. Some patients have tight pelvic floor muscles, others don't. Some patients have related conditions, others don't. And you really see the diversity when you ask patients what triggered their symptoms. Because for many patients, IC begins after having a baby. For others, IC begins, like myself, in childhood. For some people, IC begins after traumatic injury. For others, IC begins after an infection. So we're long past the day of thinking that everybody is the same or using a one treatment. You know, 20, 25 years ago, Elmeron and DMSO were the only acts in town. Now we know that a one treatment fits all approach simply does not work. It does not work. So we are now doing something called subtyping. We need to understand your anatomy to try to understand why you are in so much pain. So let's go over these subtypes, and maybe that will give you a little bit of insight. So subtyping has been around for 10 years longer. And actually, again, I was doing some research for this new book we're writing, and it actually started in Europe with the European Society for the Study of IC. They actually have 16 types of IC based upon pathology results. We don't need to talk about those right now. We have then in the United States and Canada, we have the U-point system, and then the input system. Those were created 5-6 years ago. The Canadian Urological Guidelines are dedicated to subtyping using the U-point system. The Americans are slower. We have not necessarily embraced a specific subtyping system. However, I think every major researcher will agree with the subtyping that I'm going to introduce. This was created by Dr. Christopher Payne at Stanford. He ran the Stanford IC research program for 25 years. He is now at vistaurology.com in San Jose, California. They are the premier pelvic pain resource on the West Coast. He proposed a few years ago 5 potential subtypes for IC. And he introduced it in a really provocative way, because in his article, he says, we should treat IC patients like cancer patients. And of course, you know, as soon as he said that, my answer was, wait, don't you dare say cancer. There's no connection between IC and cancer. You know, I mean, I didn't say this to him. I was saying this in my brain. But then he made a really compelling argument. He said, listen, when somebody's diagnosed with cancer, they don't just say you have cancer. They tell you where it is, they tell you the type of it, and they tell you how severe it is. So for me last year, I had early uterine cancer, complex endometrial hyperplasia with atypia and a vague architectural complex. I say that very fast because I like to move on. We knew based upon my diagnosis exactly what I needed to do, which was an urgent hysterectomy. He says when somebody's diagnosed with IC, there's no specificity. There's not a logical pathway to treatment. And he said, we deserve that. Patients deserve that. Doctors deserve that. We need to give you a clue as to what direction you should go to explore what treatment that could work for you more effectively. So here are the subtypes that he proposed. IC subtype 1, Hunner's lesions. Okay, we all agree around the world. This is its own unique subtype. In Europe, this would be IC subtype 3C in the European system. Hunner's lesions. Hunner's lesions require very specific treatment. Hunner's lesions are different from all the other patients based upon biopsy results, because there's massive inflammation in the bladders of patients with Hunner's lesions. Okay, so if your pain is coming from Hunner's lesions, then we need to get these Hunner's lesions treated, because when you treat them correctly and you silence the nerve, the pain go away. There's also the concept of location. So if this is your bladder, and we know that it fills from the bottom up, if you have a lesion up at the top, that's pretty good, because urine doesn't normally get that far. If you've got a lesion down at the bottom, literally a teaspoon of urine on that lesion could hurt. So it's also kind of about the accident, the location of where that lesion is, or the location of where your bladder injury is. If you have an injury low, then the odds are when you've got urine in there, it's going to be on that injury and it's going to hurt. If it's a higher injury, you might be better off. Okay? You can read more about Hunner's lesions on our website. We have videos also. And if you're calling, I'm not going to answer the phone. You hear the phone ringing right there. IC subtype 2, bladder wall driven. Hold on. Let me make sure that's not an emergency. Nope. All right. All right. Okay. So these are the patients whose symptoms are being driven by their bladder wall. So they have pain as the bladder fills with urine that is relieved by urination. So the fuller they get, the worse they feel. And when you pee, you feel better. Why? Because here's your bladder. So think about it this way. As your bladder fills with urine, urine is touching and entering these wounds. And then as soon as you pee, urine is no longer touching the wounds. Thus, you have a tremendous sense of relief. It's like, thank God I found a bladder. I mean, a bathroom. Now, granted, that relief might only last for 5 minutes, but there's definitely a profound sense of relief. In this subtype, there are subtypes. So bladder wall driven can happen for a couple of different reasons. It can happen because of a chemical injury. So if you're drinking a lot of diet soda or coffee, that's well known to irritate the bladder wall. Listen, your bladder was designed for life 5,000 years ago. We weren't drinking coffee 5,000 years ago. or massive amounts of orange juice or things like that. Today's modern diet is pretty corrosive to the bladder over time. Okay. So we know one trigger is going to be strong acidic foods or caffeine. Another trigger is potentially going to be chemical injury, something like that. So if you've gone through chemotherapy, radiation, if you've taken a medication that has kind of burned your bladder, there's some medications that are kind of notorious for being more bladder irritating, like chemotherapy or Augmentin, an antibiotic, once really irritated me. Hormones can cause bladder wall symptoms. If you are low in estrogen, then you're low in mucus, which means your bladder cannot defend itself. If you've ever used ketamine, ketamine can cause bladder wall injury. Okay, so if you're having, if you come to our website and you sign up for our free newsletter, you will get as a gift our 40-page flare management guide, and it will have an hour-by-hour rescue plan based upon the type of flare you're having. So there's an hour-by-hour rescue plan for a bladder wall flare. Okay. And this is the subtype where a bladder coating might apply, whether it's Elmeron or a supplement or a rescue instill. This is the subtype, which is the biggest subtype, pelvic floor injury. So these are the patients whose symptoms began after some sort of muscle trauma, a car accident, a fall, a rape. One gentleman that I was working with early this year had an absolutely spectacular tailbone injury where he slipped in his socks on a wooden staircase, and then he fell butt first, tailbone first, down the staircase. And after that is when he had his symptoms of frequency urgency pain. And there's no doubt in his case that he sustained a pelvic floor injury. You know, and again, it's important to note that the pelvic floor muscles can cause bladder symptoms. Okay, why? Here's your bladder, here's your pelvic floor, here's your tight pelvic floor. When you have a tight pelvic floor, you're depriving your bladder of nutrition and blood flow and oxygen. And so your bladder is going to struggle to heal. Your bladder is going to struggle with things. Ooh, the yellow jackets are back outside my window. Dang it. Got to go spray. All right. Okay, so for these people, they might not even know they have a muscle injury, but they start having bladder symptoms. They got frequency urgency. So what do? You call the doctor, say, I have frequency urgency. The doctor goes, maybe you've got an infection. Maybe you got an infection. They give you antibiotics. They don't work. Go back to the doctor. The doctor goes, oh, maybe you've got prostatitis, or maybe you've got overactive bladder. They give you those meds. They don't work. You come back to the doctor. The doctor goes, oh, maybe you've got IC. Let's give you IC meds like Elmeron. They don't work. You follow the diet. They don't work. Okay. Why? Because the fundamental problem is tight muscles. It's tight muscles. And so again, our therapeutic objective for this group of patients is to restore blood flow by relaxing those muscles. Elmeron is not a treatment for pelvic floor. Physical therapy is a treatment for pelvic floor. Muscle relaxants is a treatment for pelvic floor. Vaginal Valium suppository, oral muscle relaxants, vaginal medications, rectal medications for men, okay? But ultimately, it's about muscle work, my friends. You got to get back in touch with your muscles. Listen, some of you out there are not athletes in any way, shape, or form. You know it. We all know it. You've never had to work with your muscles before, and they're messing with you now because you've never worked with your muscles. You might have gained weight. You might be sitting for long periods of time. You might be older, or you might be the ballerina who literally danced for 15 years to the point that her muscles are so tight she can barely walk. Muscles get hurt. Subtle difference. One of the subtle differences is that when you have tight pelvic floor muscles, it's hard to start your urine stream. So you tend to sit on the toilet or stand in front of the toilet for 5, 10, 15, 20, 30 seconds. I was working with a man yesterday, like literally an hour he has to wait before he can relax enough to pee. Okay, so it's hard to start your urine stream. Constipation is common with people with tight pelvic floor muscles because your pelvic floor muscles, you know, are the only muscle group that have structures going right through them. So you've got your rectum going through here, you've got your vagina, your urethra going through here. And so if they're tight, it's hard to let stuff out. That's why it's hard to pee, it's hard to poop. And it's also hard to have sex because it's pretty hard for a penis to get through the tight muscles. We call that vaginismus. Okay. You can feel a heaviness. You can feel a downward sensation, feeling like something's falling out of you. Or in my case, my symptom is freaky because, again, it started after my hysterectomy last year. It's like there's a fist up my vagina that is just grabbing onto my viscera, whatever it can, and then it's pulling it down. That's what my pelvic floor spasms feel like. And they are levator spasms. They're levator spasms. Weird. IC subtype 4 is a nerve injury. So these are the patients whose symptoms are neurologically driven and their discomfort is neurological. So their pain is electrical. It's like being shocked by something electrical or zapped. Their pain is positional. They're fine when they stand, but when they sit down, it hurts. When they bend over, it hurts. Or when they squat down, it hurts. Okay? So movement drives their symptoms. And ultimately for them, if it's not a direct nerve injury, which is actually pretty rare, it's usually about super tight muscle squeezing nerves. And so our primary therapy for this is going to be calming nerves down and or relaxing muscles. I get this on this left side. It occasionally shoots down my leg. Hello, sciatica. IC subtype 5 is central sensitization. So these are the patients who have a lot of related conditions. This is my core subtype. I've got, let's see, I'm a walking, talking, sensitive person. I have been, hello, I'm a redhead. These patients have a sensitive stomach. They have a sensitive gut. We've got a sensitive vulva. We've got a sensitive bladder. We've got, for me, a sensitive rectum. Like, oh my God, really? Really? Oh, so frustrating. So frustrating. Characterized by very sensitive skin. We are drug sensitive. A normal dose of a medication is often too strong for us. We have to take half doses, baby doses. We are often food sensitive. There are some foods that just don't work in our body, period. Not our bladder, our entire body. I spent most of my 20s trying to figure out these foods. I want to swear. The F word comes to mind. These food sensitivities were agony to figure out. I mean, my friends were out getting married and having babies from like the age of 23 to 28. I was at home laying in the fetal position with bowel spasms every morning because my bowel was crazy because I had developed food sensitivities. And it took us 5 years, and thankfully a book from my sister helped us figure out I had become sensitive to oatmeal. What did my doctor having me eat every freaking day? Oatmeal. What was killing me every single day was oatmeal. As soon as I stopped the oatmeal, it was gone. 5 years of unnecessary pain. If you have a lot of food sensitivities, guys, you can request food sensitivity testing. It's called ALCAT, ALCAT. God, I wish we'd had that when I was in my 20s. It would have really changed my life because it was brutal, absolutely brutal. So if you have this subtype, central sensitization is in many cases just inherited. Kind of goes back to our ancestors. My family comes from Norway. If you believe in evolutionary adaptation, we know that species adapt over time to new stressors. The fastest cheetah survived because they could catch food. The slowest died because they couldn't catch food. The fastest gazelle survived because they could run against the cheetah, away from the cheetah. The slowest died. We know this species adapt over time to stressors. An adaptation occurs in 5,000 years. That's how long it takes an evolutionary adaptation to occur. So ultimately, our bodies were designed for life 5,000 years ago. Now, because I come from the Arctic Circle in Norway and Sweden, what were my ancestors eating 5,000 years ago? The world's blandest diet. Fish, deer, seals, whale, berries, greens, maybe apples in the summer, and salt. There was no coffee. There was no tea. Chocolate comes from Africa. There was no chocolate. You know, coffee comes from Latin America. There was no coffee. Tea comes from Asia. There was no tea. My body is not designed to thrive on those foods, which would explain why those foods tend to bother me more. Because maybe my body doesn't have defenses for those foods. So it is not, I don't look at it as a disease process at all. I don't think of it as a disease at all. It is my landscape. It is my foundation. And it explains my life. Praise God, hallelujah. Because when I was in my 20s, I thought it was my fault. I thought I was damaged goods. It made no sense. I felt unworthy. I felt unlovable. I didn't understand why my friends were getting married and having babies, and I was in pain every freaking day. But when that research came out when I was in my early 30s, and then we had the family research showing this passes along in families, and I looked at my family and I went, oh, hell, wait a second. My sister has this. My mother has this. My aunt has this. My cousin has this. My grandmother had this. Holy crap. It was never my fault. I inherited a sensitive nervous system. And my job and your job, if you are one, is to understand that not everybody's wired the same. Not everybody's wired to be an orthopedic surgeon or Michael Avenatti and, you know, somebody super powerful and aggressive and outspoken. Some of us are wired to live a quieter life, to have a quieter career. I was miserable working in the city. Work was easy. Worked for the feds. Could have done the work with my eyes closed. But getting to work and living in the city and working in the city and the smells and the sounds and the foods did not work for me. I was miserable. I thrive in a quieter environment in the hills, which is why there's a hillside right outside my window. So when you have central sensitization, a lot of this is understanding and respecting the fact that your nervous system is wired differently. And frankly, we need sensitive people in this world right now. There are many, many gifts to being sensitive. The big gift, number one, is we're going to smell the fire first. We're going to save lives. Like last year when we smelled the fires when my town burnt down, right? People who are sensitive tend to be a bit more intuitive. We're really good at helping other people and listening to other people and figuring out if there's a problem. We can walk into a room sometimes and tell that somebody's struggling and reach out to them. We tend to be incredibly animal sensitive. We thrive with that. We need sensitive people in this world right now. And so don't look at this in a bad way. This is a wonderful, wonderful thing. But you've got to find that environment that makes your body thrive. Generally, somebody with central sensitization, you got to get the chemicals out of your home. This means no scented candles, no Febreze, no crazy room sprays, no oven cleaner. It's about living a really clean, simple life. And making your home a safe haven where you're protected, where your nervous system is protected. You know, when you make an appointment with a doctor and they say, please don't wear scents to this doctor's office. That's because there's somebody in that doctor's office who's like me, who's got central sensitization. And the freaky thing about it is, for us, certain smells hurt. You wouldn't think a smell would hurt, but they do. They do. And we've got to run. I had to run out of my house when a guy cleaned a rug and I told him not to use anything, and he did. And I'm running out I was gasping out on my driveway as he followed me. And I told him, don't do anything. What the hell did you do? And he goes, yeah, I put some stuff on it from my factory. I mean, from our warehouse. I said, I told you not to do that, you son of a gun. Why did you do that? And he could see me gasping for breath. Okay. So that's a 5 subtype. So I am IC subtype 5, IC subtype 3 primary, IC subtype 2 secondary. It means I live with a sensitive body, and that's fine. I accept that. I love my body. But I have really screwed up muscles right now. From my left piriformis SI joint is screwed up. And so my primary focus is on calming my nerves, protecting my nervous system, and working on those muscles. I don't have bladder symptoms very often anymore. Hallelujah. All right. So getting back to that question, what kind of pain are you having? You're in pain every day. We have to figure out why. Is it bladder wall? Is it pelvic floor? Is it nerve? Come to our website, sign up for the newsletter, download your flare management guide. That will give you tips. And generally, if you're at the point where your bladder is screaming at you, it means that you've really badly irritated it. And we're either going to look at infection or really screwing up with your diet. Those are going to be the 2 key things for pain as your bladder fills if it's screaming. So if you've had a soda, if you've I wrote a blog on our website, Anatomy of an Utterly Ridiculous IC Flare, and I had started the day with something like I had a little bit of orange juice, and then I had for lunch a burrito with hot sauce on it, and then for dinner I had something else, and I was up all night that night crying. You know, we all do that at first. You know, so sometimes you just forget. Even me, I forget sometimes. All right, going back to your questions. Can take vitamin C cause burning in the bladder? Yes, absolutely. Vitamin C is ascorbic acid. Most of it is ascorbic acid. It is cheaply manufactured from citrus fruit. Citrus fruit in general, citric acid in general is one of the most irritating acids for the bladder. Therefore, commercial vitamin C preparations are normally derived from citrus, and they are normally very irritating to the bladder. You also, Svetlana, say you've got spotting. I don't know what that is. If you're talking about spotting vaginally, vitamin C would not be associated with that. If you are spotting vaginally, you need to talk to your gynecologist about it. Let that know, because I was spotting a pale pink lemonade kind of thing on my mini pad, very, very pale. And that was the first sign of early uterine cancer. So act on it, okay? Hello, Charlene. Thank you for joining us. Ashley says her IC doesn't feel like urgency or bladder pain per se, but more like a really bad period cramp that wraps around your sciatic area. Ashley, you just described a perfect pelvic floor flare. And I'm glad you got your bracelets. Ashley, you're not going to know if you're allosensitive until you try it. And so again, I would try a very, 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 very small amount. Hi, Michelle from Australia. Awesome. Very nice to see you. Michelle, they're not different strains of IC. There are different types of IC, but if you have ulcers in your bladder, that you are in IC subtype 1, Hunter's lesions, Hunter's ulcers. Ashley asked about marshmallow root. Marshmallow root was pretty much a fad about 15 years ago. Some patients find it soothing, but about 50% find it soothing, about 50% find it irritating, so be careful with it. Ashley said, can you take Desert Harvest Aloe, the multivitamin, and Sister Renew at the same time? I would recommend that you start doing that. You need to stick with one at a time and make sure your body tolerates one before you go to the next one. We do have a low-acid vitamin called Multirite. This is a formula that I helped develop. The CEO of Far Labs was talking to me one day, and he said, is there anything you could make for an IC patient? If you could make anything for an IC patient, what would you make? And I said a low-acid vitamin. Because if there's one thing I always had to say no to was when patients said, is there a vitamin that's IC friendly? And the answer was no, until this. I didn't think they were going to act on it. He called me back 6 weeks later and said, we've made your low-acid vitamin. That is Multirite. Even I take this. I have no problems with it at all. This is well tolerated by most IC patients. unless you have Hunter's lesions that might be more irritating. And again, with this one, I recommend cutting it in half or cutting it in quarters and starting with a very, very small amount. This is a real horse pill. It's big. I think I have an open container here. Yeah, I do. You know, you can see it's about an inch. So when this came out and they sent it to me, I cut it in quarters. I was like, I'm not taking anything full dose at first. My bladder was so sensitive back then. My bladder is much better now. I'm living proof that healing happens. What about, Rhonda says, what about probiotics for IC? You know what? That's the really interesting thing is you would think that probiotics work for everyone. And I am astonished to say that some people flare after probiotics. And I don't understand why. I don't have the firm data. I'm going to say it's like 75% tolerate probiotics just fine, but 25% report flares after probiotics. I think that there's kind of a movement to focus on prebiotics because it's really rare that a prebiotic would be as irritating. What I would just say is rather than doing a man-made preparation, try to get live cultures. Go for a yogurt, you know, but don't get a high sugar yogurt. Don't get a lemon yogurt. I do a coconut milk yogurt, unflavored or blueberry, or I go to a local frozen yogurt place and get my little treat that way. But live cultures are really the way to go. Live cultures usually don't provoke like a probiotic capsule or pill. We do sell in our store, Douglas Labs, a 40,000 count probiotic. I haven't had any complaints about it, you know, but we're all different. You know, you can come to our store, iconsales.com. We've got all the supplements and the low acid vitamin and other things there that you might find helpful. I wish I could give you an absolute. I just can't. Cindy says, can you take more than 2 Cysto Protect twice a day? No. More is not better, guys. Come on, let's get away from the more is better concept. That's what the manufacturer recommended for a reason. We don't want to take toxic levels of potentially anything. And you may be, by adding more, you could be triggering things that we don't want to trigger. I operate from a less is more perspective completely. Charles asked about amitriptyline. Amitriptyline is a low-dose antidepressant, and so it's been a recommendation for IC. It's in the American Urology Association guidelines. You should never be offended if somebody says take an antidepressant. Do not make the mistake of assuming that they say that it's all in your head. It is not all in your head. A low-dose antidepressant can help calm nerves down. And again, I'm going back to this document that I showed early in this. So this, again, this is kind of an example of what happens. So we've got a bladder injury. We've got damage to the bladder wall. It causes urine to go deep into the bladder wall, which then activates nerves. And you can see here in the dark boxes how the different therapies work. So a bladder coating helps protect the damage. A tricyclic antidepressant helps calm the nerves down. And a low-dose antihistamine, hydroxyzine, helps calm the mast cells down. So I'm in support of you trying that. But again, because the American Urology Association has it as an option, I will tell you that with my freaky sensitive body, it did not work for me. I tried 4 different antidepressants, amitriptyline, imipramine, nortriptyline, and one other one. And I just got side effect after side effect after side effect. They were I simply could not tolerate them myself. One thing about amitriptyline is that it can, for some people, it can trigger heart issues, a rapid heart rate, and that's what it did for me. And so I had to get off of it. There's nothing worse than trying to sleep with your heart pounding in your chest. Carmen asked, does Elmeron help with hunters? I just had a hydrodistension and a nickel-sized ulcer cauterized. Should I stop the Elmeron and stick with the heparin instills? I don't know any doctor who says that Elmeron is helpful for ulcers. But what Elmeron would do is it would provide a bit of a protective coating for your bladder. But again, now we know that Elmeron has been linked to some eye damage in patients who take it for a long period of time. So if we follow the AUA guidelines, what they say is start in step 1 with the supplements. Elmeron is in step 2. So why not try the supplements first, since they have a lower rate of adverse event and side effects. And frankly, you won't go bankrupt on a supplement, whereas Elmeron can cost a couple $1,000s a prescription at this point in time. Let me drink some water here. Lily says hormone fluctuations affect her bladder the worst. How do we deal with this? Well, you know, getting back to that bladder wall subtype, one of the subtypes is hormone. And so you could be dealing with a menopause, low estrogen that is just slowly made your bladder wall thinner. But there is a subtype, and it's a mystery subtype that really no one quite understands. Here we go. There it definitely is a small group of patients who are just hormone driven, even in their 20s. And I've worked with a handful over the years, and basically what they've had to do is either go on birth control, they get their hormones tested, and they try to get them stabilized in some way. And when their hormones get stabilized in some way, then things seem to improve. Veronica says, if Elmeron is taken at a high enough dosage over a certain amount of time, it will cure IC. That's a quote from the creator of Elmeron, Dr. Parsons. Nobody believes that anymore. That might have been true 20 years ago when our knowledge of IC was very different. Our knowledge today now is extremely different from that. And we don't look at Elmeron as a cure for anyone because it does not address a disease process. But it is a coating, and it has helped quite a few people. But again, it has no role for patients with pelvic floor issues. Wow, he said that this weekend at the Walk for a Cure for IC? Yeah, I haven't talked to him. I don't know if he knows about that research with the macular eye issue. I adore Dr. Parsons. He has done so much for the IC movement. We probably owe him more than any other doctor for his dedication and compassion. And he created the potassium sensitivity test. He created the PUF questionnaire. He taught the IC classes for years. And he invented Elmeron. But you know, he's the Elmeron guy. His career is really focused on Elmeron. I just saw him 3-4 weeks ago. He also is pursuing another very important theory that toxications in urine could be causing bladder wall damage. That research was supported in a multi-center study, including Robert Evans at Wake Forest. And that data was really fascinating. And he may be onto something there. But Elmeron is not the only act in town. It is not the only treatment out there. Laura says, my gynecologist just put me on low-dose hormone pills since I was having bladder UTIs because she said my hormones are low. Hearing that you got cancer from them makes me nervous. In your opinion, is it better to use an estrogen cream? I would say the industry in general would say that the risk using an estrogen cream are far less than the risk of taking it orally. You know, we had no history of cancer, of any estrogen-driven cancers in my family, like on both sides. Nobody has had breast cancer or uterine cancer or ovarian cancer. Nobody. I thought I was perfectly safe taking oral estrogen. I started taking it because I was having a lot of muscle cramping related to, you know, going through perimenopause. And stunned doesn't even begin to describe how I felt. And I asked him, I said, why me? Why would this have happened to me? And his answer was, I don't know. You just have the cells that get turned on by estrogen. So I think that's something you need to talk to your doctor about. In general, what the industry says is when you take it as a topical formulation, it does not go systemic where it can trigger other things. It tends to stay concentrated in that area. Catherine asks, would a back injury to T10, T11 count as an injury to the pelvic floor? I'm in the hospital now, weeks of back surgery, still getting flares. I could, sure, because you got like your psoas muscle, which begins in your pelvic floor and goes up your back. You know, it's a big fat muscle. And if that was traumatized and if that is tight and pulling your pelvic floor up, that could explain it. Tina asks, can you have all the subtypes? Not usually, but you can certainly have 3 or more. I mean, if you got Hunter's lesions, then that's the king. We wouldn't say you're bladder wall driven. We would say that you're Hunter's lesion driven with pelvic floor, because your pelvic floor is going to get tight anyway, anytime you're in pain. Can nerves regrow? Yeah. Yeah. In fact, that's one of the reasons why we don't really support the use of hydrodistensions as a treatment for IC anymore. Because when you have a hydrodistension, you stretch the bladder. And when you stretch the bladder, you break the superficial nerves in the bladder wall. And so after a hydrodistension, patients often report that they feel better. And they feel better because you've broken those nerves. But those nerves always grow back. And that is why 2, 3, 4 months later, your symptoms return. So yeah, nerves grow. The challenge is sometimes more nerves grow than you originally had. Your body is kind of reacting to that. I was seeing about a research study that I must have seen like 15 years ago. And it was saying something like, if you're in short-term pain and you have acute pain, let's say you have acute bladder pain, and bladder pain is organ pain. It is characterized by being relentless and difficult to ignore. Bladder pain is agonizing pain, just the same as if your stomach gets too full and you're stretching it. That's like the worst thing you can do to a hollow organ. And it's temporary. It's temporary. But it does go to the spinal cord, uses a different part of the spinal cord and arrives at the brain. And your brain goes, uh-oh, you're in pain. So your brain is trying to protect you from that pain. And sometimes a secondary effect of being in pain for long periods of time is you get more nerves activated because and I don't even think we really even understand what our amazing, miraculous body is trying to accomplish. But it is known that more nerves can become involved. Ashley says, if it's a pelvic floor flare, what can you do? Ashley, you relax your pelvic floor. Go take a hot shower. Go take a hot bath. Do your stretches. Get down and squat on the floor like I showed before. Do a nice guided relaxation to relax your body. If you have a muscle relaxant, you can try the muscle relaxant. Again, go to our website, sign up for our newsletter, and you can download our 40-page flare management guide, and it will give you an hour-by-hour rescue plan. I really need to update that, but it's really good. Hello, Julie from Pennsylvania. So Cindy says, after 10 years with IC, recently had 6 pelvic floor treatments with physical therapy, 5 installations. Last week had surgery with hydrodistension. Doctor found nothing. I hurt every day in my urethra. So Cindy, I had a hydrodistension last year as part of my hysterectomy, and my bladder's normal too. That's normal. What that tells me is you don't have a bladder wall driven subtype. You've got a pelvic floor driven subtype. So I would be focusing more on your muscles. And maybe you've got some central sensitization going on there too, where you've got to kind of calm those nerves down. Veronica asked why Elmeron is so expensive. Because Elmeron went out of patent, and when it went out of patent, that meant it opened the door to a generic. So what happened is the pharmaceutical company raised the price, I think, to try to make as much money as they could until a generic came out. That's my personal opinion. That's what I believe happened. And unfortunately, the company that makes the generic, it is available in Canada. It is available in Europe. It is not available in the United States because they are required to complete all the original studies. And again, now we know that Elmeron may be linked to eye damage in some patients who take it for long periods of time. Laura says she's been on continuous birth control so she gets no periods to aggravate her bladder, and you've been doing that since 9th grade. Yeah, there's definitely a small group of patients who do that and get relief. Svetlana says she has Hashimoto's and she's wondering if her IC is immune related. Oh, let me see if I've got it open here on my computer. Again, writing this chapter, right, for this new book, and I was diving through a lot of old research studies, and we talk about IC subtype 5 central sensitization, and we talk about genetic linkages. There is a specific gene chromosome 13 has been connected to thyroid issues, which I also happen to have. It has been connected to anxiety disorder. It has been connected to this genetic IC and irritable bowel. So I don't see the connection being an autoimmune connection. I see it being a chromosomal connection. That may be, and again, you talk about evolutionary adaptation and how things change over time. I still believe that our lineage sorted out sensitivity and sorted out some of these things based upon the environment 5,000 years ago. IC does not meet the criteria for autoimmune. There's 4 specific criteria. It doesn't meet all 4 of those. It might meet 2 of those, but not all 4 of those, only in some patients. Remember the subtypes. It doesn't relate to the ballerina with pelvic floor injury. Let me go back to YouTube here for a moment. So in Europe, Sonia says Elmeron costs 650 euros a packet. Actually, that's a deal, my friend. It's much more expensive here in the United States. Laura says she had a pudendal nerve interstim for your pelvic floor and it helped. Had to do your own research. Cool. You know, interstim is a step 4 treatment option. It's called neuromodulation. There are 2 different forms of neuromodulation. One is done at the ankle and one is done at the lower spine. The ankle stim is much less traumatic. It does not require surgery. It is called urgent PC, and that's normally where patients first start with neuromodulation, because having the surgeries that require for a surgical implant are much more associated with other issues and other problems. So, Laura, I'm really glad that it helped you. That research was done first by Ken Peters at Beaumont Hospital, and he's on our medical board. Rhonda says, I have flare-ups, which is often my lower back and kidney on my left side hurt very, very bad. Can IC cause kidney pain? You know, anytime you have pain to the left or right of center, that kind of rules out the bladder and makes us focus on other structures on those sides. Lower back, kidney pain, I'm really thinking pelvic floor tension more than a bladder wall flare. IC is not normally associated with kidney pain unless it's pelvic floor pain. But you know, when in doubt, you know, you could have kidney stones. Guys, let me just put out a statement about kidney stones. We've learned a lot about kidney stones 3-4 months ago at the American Urology Association. Number one, we know kidney stones are covered with bacteria. Who knew? We know that patients prone to kidney stones are deficient in a bacteria that metabolizes oxalates. That sucks because most stones are calcium oxalate driven. So if we've killed the bacteria, which normally keeps oxalate levels low, that's a challenge. I've told this story many times. We had a patient that I was working with earlier this year who had been suffering for years with what she thought was IC. She was afraid to have any tests. When she finally allowed somebody to look in her bladder, they found a giant calcium oxalate stone that was so big it wouldn't pass out. And she'd had this sharp crystals floating in her bladder, cutting her bladder. And when they removed that, her symptoms went away completely. Her bladder healed. If you drink a lot of almond milk, you do a lot of foods that are high in oxalates, you are making yourself potentially more prone to oxalate-based kidney stones. So, Rhonda, getting back to you with that kidney pain, I would definitely talk to your doctor about that kidney pain. Let's make sure you don't have a kidney stone. And let's rule that out. I don't like guessing. I mean, seriously, if I'm in pain, I want somebody to look at where I'm hurting. I think you should do the same. I think you should have somebody check it out. Ashley says, why is the pain always on the left side? That's because you have a problem on your left side with your pelvic floor. My pain is also on my left side. My pain is, let's see. Oh God, I'm wearing white, which can make my butt look big. Sorry about that. So here's center. My pain is always right here, right there. And that is piriformis pain. It's piriformis glute pain from a screwy left SI joint. Laura says, your left was rock hard, so they put the lead on the pudendal nerve. So, Laura, you still need to be working on trying to figure out why your left side is so hard. You know, Beaumont Hospital has these wonderful guided relaxation tapes that will walk you through how to relax your entire body, including your pelvic floor. We sell them on our website. They're $17.50. I would be doing that. Tabitha had ordered her UTI DNA kit. You're waiting for the results to come in. It'll be fascinating to see what it says. Guys, we're talking about next generation urine testing. I built a website on it called bladderhealth.org earlier this summer. You know, we're kind of in this, oh gosh, I don't even know how to say this. There has always been a small group of patients and or a tiny group of doctors who have believed that every IC patient was a result of some sort of chronic infection. And, you know, we're kind of long past that because we know, like the ballerina with a muscle injury, we know that muscles play a big part of quote unquote IC. But there is still a small group of patients who could have chronic infection. If you're somebody who has had a recurring bladder infection and the antibiotics are not working and the test keeps showing recurring infection over and over and over again, you know, that's when you go to next generation DNA testing. It costs $199. It's super cheap. It used to cost thousands of dollars years ago. And what this will do is this will identify every bacteria and fungus in your urine, both good and bad. So it's going to help us see the population of what's living in your bladder to kind of give you a different piece of that puzzle. We know that the MAP Research Network, which is a federally funded NIH network that studies IC and chronic prostatitis, they are the ones who determined that many patients having flares actually have candida infections in their bladder. And unfortunately, typical urine testing does not identify candida. This test will. I had a candida infection for 2 years. It was because I took Augmentin for a long period of time under the mistaken belief that my IC was bacterial. And now we know, no, my IC was genetic. It wasn't bacterial. The legacy of taking those antibiotics for me was it gave me a very drug-resistant candida infection. It took us 2 years to kill it. And we missed it. We missed it. They finally found it just using a microscope. So this is just another piece of the puzzle that I think is meaningful. Now, I will tell you that I did this too. After my hysterectomy, my urine got very cloudy. For almost a year, it was cloudy. I had no bladder symptoms, right? I didn't have frequency urgency pain, but my urine was cloudy and it didn't make sense to me because I was drinking a lot of water. And so I thought, what the hell? I'm just going to have the test. And I've shared my results in other lectures and support group meetings. What it found for me was lots of good bacteria, and there was a tiny population of E. coli and actinomyces, and I think one other. And so what did that mean? It meant, okay, I have a little tiny bit of E. coli, a little tiny bit of actinomyces in my bladder. Was it worth destroying my entire biome to take an antibiotic? No, absolutely not. And I chose not to do that because I'm not having bladder symptoms. And that kind of raises a critical point here. And that is, we don't really yet know what's normal in the bladder. You know, the urinary the cool thing about this is that this has broken once and for all the concept of that urine is sterile. We now know that there are many beneficial bacteria that live in the bladder. Now, we all thought bacteria was bad. It's not bad. That our body needs certain species of bacteria to survive. We have trillions of bacteria in our body that do good things. And we have bacteria in our bladder that do good things. But they're still mapping what we call the urinary biome. We're still trying to understand what's supposed to be there and what's not supposed to be there. The challenge with antibiotics is it kills everything. It's like putting a flamethrower on a forest. You kill the trees, you kill the bushes, you kill the insects, you kill the butterflies, you kill everything. And an long-term antibiotic use has now been linked to some really bad things. We don't need to kill the good bacteria over and over. And well, it's not we don't need to. We try not to. There's some patients who have to take long-term antibiotics because they've got a really bad, dangerous infection. But what you should not be doing is self-medicating yourself with an antibiotic when you have a flare, because you could be having a muscle flare. And again, seriously, people, before you do it, at least do this. At least test your urine first. That is the critical first thing before you take it, before you take an antibiotic. Cheryl says she's been diagnosed with a cystocele and rectocele that needs repair plus I. Is this common? It's common in people with pelvic floor issues. Rectoceles and cystoceles are little pockets. They often happen from straining. They often happen. I was working with a guy with a cystocele who had they thought it was really tight pelvic floor muscles, but when they actually went in, they saw that his prostate had almost filled his urethra, and he had backflow, and there was so much urine in his bladder, he developed a pocket, a cystocele. They're fairly common. I have a little rectocele myself. And so the theory here is let's keep yourself, constipation is your enemy. Hard stools is the enemy. You want to try to keep yourself regular, eat lots of good high fiber. That means eat lots of green peas if you can. That's been my secret. And don't strain. Try not to strain. Don't push to have a bowel movement. Don't push to pee, because that's what messes up your pelvic floor in the first place and can cause other things. Debbie says, is it common for IC sufferers to have thyroid problems? Yeah, it is. We don't necessarily know why, although as I said earlier, it might relate to chromosome 13, which might relate to IC subtype 5. I was diagnosed with low thyroid back in my early 20s. Most low thyroid, some hyperthyroid. Get it tested. Cheryl passed a 7-millimeter kidney stone 3 weeks ago. The worst, yeah. So Cheryl, again, look at your diet. Are you eating foods that are high in oxalates, like spinach, like chocolate, like almond milk, almonds? Your doctor should have given you some recommendations for your kidney stone. Kelly says she's had IC for 10 years. I'm in so much pain now. Just had 6 installations, still in pain. I'm a teacher, almost thinking of giving up working. I take Elmeron. Is there anything else I can do for pain? I already do hot showers, heating pads. Call the doctor. They just said manage the flare. There's nothing they can do. So Kelly, again, what we have to do is we got to figure out what kind of flare you're having, my dear. Are we having a bladder wall flare or a pelvic floor flare or both? If it's a bladder wall flare, then you got to be on top of your food. You got to be on top of your diet. And you can do something like azo urinary pain relief tablets as needed. You don't do it every day, but something like that might be helpful. Again, if it's bladder wall, you should be trying one of the supplements like Cysto Protect, Cysto Renew. See if that can put a bit of a coating in your bladder to try to soothe your bladder, or Desert Harvest Aloe, which is also very soothing. But the other question is it a pelvic floor flare because you're on your feet all day? And if you're a pelvic floor flare, that's why the hot showers are helpful. Heating pads, things like that. So I would want you to have a pelvic floor assessment. Let's see if we can get to the bottom of any long-term pelvic floor issues that might also be contributing to that. When we survey patients and on their careers, it might really stun you to know that the top 2 careers were nursing and teaching. More IC patients are nurses and teachers. And I think one reason why is because of the lack of access to a restroom. I think that does play a role for some patients. I was working with a nurse again earlier this year who for 20 years had been drinking Crystal Light. All the nurses, that's what they did at her hospital. They drank Crystal Light. And boy, did she fry her bladder after 20 years. Kelly says, is there a support group you can join? Well, this is a support group. We have a support group on our website with 50,000 members, 51,000 members now. We have a 24-hour forum. There are lots of support groups on the internet in different places. There are support groups on Facebook too. You just need to be kind of shrewd. I will tell you that Facebook is very challenging at times because some groups end up in lots of fights. And so we want you to have a soft, warm place to land. And if you can find that on Facebook, that's great. But you can come on over to the IC Network and join our support group too. We are the largest support group in the world. We are the oldest support group on the internet because I started the first online support groups for this. Back in the 1990s. I'm that old. The IC Network was my doctoral dissertation proposal in psychology, as a matter of fact. An online support group for IC. And ironically, I could not get the degree because it hurt to sit in the car to drive to school. Got my master's, couldn't do the PhD. I still want it today. Ashley says, have I heard of Cystoquel? No. Cheryl says she loves azo. Good. Just don't do a lot of it, hon. It's not meant to be used every day. Use it as needed. Low-dose naltrexone is also an option. Are there any supplements for pelvic floor flares? No. No, there are no supplements for pelvic floor flares because they're muscle flares. And with a muscle flare, you've got to do muscle work. You have to do muscle work. All right. It has been 2 hours and 24 minutes. Last call for questions. Last call for questions. Sonia on YouTube says, does physiotherapy help? You better believe it helps. Actually, pelvic floor physical therapy is actually far more effective than almost any other IC treatment out there in research studies. When that research study came out in 2008 that showed that pelvic floor therapy reduces symptoms of IC, that was when the IC world changed. And that was when we all had to accept that IC was not a bladder disease in some patients, that in fact IC can involve other structures in the pelvis, usually the pelvic floor. All right, guys, listen. I always end my meetings with 2 things. Number 1, if you found this helpful, please support our work. You know, our website is free. There's no paywall. Our support groups are free. The way we make it happen is we have a magazine, the IC Optimist, and you can sign up for that right on our website and become a member of the IC network. And that's what makes this free support group meeting happen. And that's what makes our work happen, as well as, hello, IC Awareness Month. So please come on over to the IC network and become a member of the IC network. If there's absolutely one thing I need you to hear from me that I want you to remember from this conversation is this is not your fault. You have done absolutely nothing wrong. There is no shame. There is no blame. I do not want you to carry any burden. I do not want you to feel like you're damaged goods. I do not want you to feel like you are lovable, because you are no different. You are lovable. Your IC does not change your heart. It does not change your soul. It does not change your spirit. It does not change your ability to be a wife, to be a mother, to be a friend, to be a sister, to be a daughter, to be a father, to be a brother, to be a son. Don't let it change you. You are no different than someone who is hit by a car. You're hurt and you need love and care from your family. I don't want you to hide it. I want you to ask for help. If you need help, I want you to ask for help, okay? No shame, no blame. You have done absolutely nothing wrong, and you are a worthy, wonderful person. All righty. So the next time you feel like you're damaged goods, I want you to pretend that I'm standing right in front of you and I'm looking at you going, stop it. No, it is not your fault. It is not my fault. It was not your fault. And I'm going to give you a big, giant hug in return. Amber says she did Botox and that helped. We didn't really talk about Botox. All right, my friends. I wish you well. We're going to do another live support group meeting this Sunday starting at 12:30. And I hope you are there. Bring your family. Bring your friends. Bring your questions. Happy to take them all. All right. Be well. Got to get back to work now. Goodbye, YouTube. Be well, my friends.